Western New York has approximately 1.5 million people. We have 8 counties. This has been a depressed area for several years. We have a high level of obesity, diabetes, heart disease. The county health rankings have given us the ability to look at each of our counties, see how they compare to the rest of the counties in New York State, so they can understand the challenges and look at what types of programs and initiatives really need to be designed. We were focused initially on clinical care and improvement of quality, but then realized that we have to really go upstream and figure out what are the root causes of the conditions that people are living with. We had to start with children. Now at P2, we've started realizing, go back even farther, start with breastfeeding. Promoting breastfeeding really gives a child a really healthy start.
The Baby Café program came out of a New York State Department of Health grant that wanted to invest resources in Buffalo and Erie County. They really wanted to have someplace for pregnant moms, breastfeeding moms to go to either get education, ask questions, they can get actual clinical support, but they're also getting social support.
It takes all the pressure off the back and everything else.
It's valuable to the individuals and it's valuable to the community. Breastfeeding has been shown to improve health outcomes for babies, for young children, for adolescents, and for moms.
Moms who come to the baby cafes are often connected to other outside community resources. They may identify a woman who has a need for something as simple as they don't have a place for the baby to sleep. They don't have a suitable crib or car seats.
We don't think any baby should come into the world and not have what they need.
Cattaraugus County is a very rural county in the southernmost part of our region. The city there, Salamanca, is right on the Seneca Nation Reservation. They have embraced a program called Healthy Streets.
Summer, come on!
We in Salamanca recognized when health rankings came out that we were among the bottom of the barrel, if you will, with respect to our health and wellness. So the city actually embraced the fact that in order for us to be well, to be fit, we needed to do something about our infrastructure. And to that end, the city went and invested in replacing our sidewalk blocks. We are looking at about 4,000 sidewalk blocks that will be replaced.
Chautauqua County is one of the other rural counties in western New York. It has the city of Jamestown. They have a very special program called Creating Healthy Places to Live, Work, and Play.
The purpose of that is to promote healthy lifestyles, and some of the strategies that we have been working toward are to increase access to healthier foods. We have worked on a big farm-to-school initiative, trying to get fresh foods in from the local farms into the school. The Farm-to-School initiative has done some really terrific work in connecting with a couple of local farmers, particularly to get corn, which they got when it was in abundance at the end of the harvest last year, and were able to freeze it and serve it during the course of the year. One of the basic premises in public health is that you have to hit people in their path. You can't ask them to go do a lot of separate things that aren't part of their daily routine. You make it easy for them. You make it easy for them to walk somewhere, as opposed to feeling like they're living in peril every time they cross the street.